To the Eastern Cape, Health MEC Gomba has been shown the door. Premier Oscar Mabuyane fired the MEC during a conference on Thursday. Gomba is implicated in the Nelson Mandela funeral corruption scandal, also the medical scooters scandal. I'm joined now by Mvusiwekhaya Sicwetscha, spokesperson for the Eastern Cape Premier Oscar Mabuyane. Thank you very much for your time. Could you just talk us through exactly what the Health MEC was found guilty of? Normally we see lots of prevaricating. How was it that the Premier was able to say she has to go?
Good evening to you and your viewers. Look, the time frame for this thing was that in May, Premier wrote to the President when allegations of corruption and wrongdoing surfaced. In October, he met with the SIU to seek information, just an update on how far are they with the investigations. In February this year, Premier received letters from the SIU. He engaged them and he received a report, and he asked the former MEC and the SG to make submissions, representations on why an action should not be taken. And after getting that, after engaging them on the action is taking, he relieved the former MEC of her duties, and Dr. Thobile Mengasha will be taken through a disciplinary process. What this shows is that Premier acts when wrongdoing is alleged because he wanted an investigation and is acting on the results of that investigation.
You know, Gomba oversaw the Eastern Cape during the second wave of the pandemic, where, if you look at the MRC excess death numbers, it suggests quite clearly that the death rate per 100,000 of COVID-19 was likely one of the highest in the world. Is her performance as an MEC for Health during this pandemic part of what is going to be reviewed?
Look, there are quite a number of areas that Premier looked at. The issue around COVID, the interesting dynamic is that the best or the well-established health systems have experienced a lot of challenges around COVID. So when Premier looked at this thing, he looked at the allegations that were made against the MEC and the seriousness of those allegations. So throughout the COVID virus pandemic, the MEC did all she could in leading the department, working with other stakeholders, including social partners of the provincial government. So the challenges that we are experiencing are not unique to the Eastern Cape. You see in the state of New York, for instance, the issue of mortality numbers are coming up. You will see it in another state, you will see it in another country. The point is, all of us are dealing with a situation that we have not experienced before. The matter at issue is that the allegations that are made against the MEC, there are charges that have been re-enrolled by the NPA around what she is alleged to have done. So the relieving of her duties is allowing her time to deal with this space. We also want to correct the misinformation that is propagated by one of the newspapers, I think the Mail and Guardian or something, that they are trying to say the Premier covered up wrongdoing. The Premier did not. When he received the information, he engaged the SIU, he engaged both Dr. Mengasha and MEC Gomba, and he took an action that is protecting the interests of government and is protecting the interests of the people that are accused of acts of misconduct.
Tell me a little bit more about the charges, criminal charges that she is facing.
The charges refer to the Nelson Mandela, the matters relating to her time when she was a councillor at the BCM on the preparations for the funeral service, funeral and memorial services of the late former president. All right.
Is she receiving full pay, or is she out with no pay?
Ms. Gomba is no longer the MEC of the Department of Health. She remains a member of Parliament because we don't know if she has resigned or not, but the information we have is that she has been relieved of her duties And it's her decision and that of the political movement, what happens regarding that matter. As government, we're not going to enter into that space.
Sure.
What we are talking to is the action that Premier has taken in line with his responsibilities as the Premier of the provincial government. He engaged the MEC on the matter before communicating the decision to the people of the province.
All right, so she remains a Member of Parliament, so I presume a salary there. Dr. Tobile Mbengashe, who we have interviewed many times, always seemed a very thoughtful, credible, highly skilled person talking about and advising the Premier. He now has to go through a disciplinary process, also in connection, while he was health superintendent, with the scooter debacle. Why was he not fired?
Dr. Mbengashe at the time was the head of department, and his responsibilities for a head of department included financial and procurement management. He is no longer in that position now. He no longer has that those responsibilities. So the action that is taken is as per the findings of the SIU, because the SIU recommended that Premier takes him through a disciplinary action to deal with the allegations that they made against him, because those allegations are talking to issues of misconduct in the context of what is in the Public Service Act and Public Service Regulations. He has an opportunity now to go to the disciplinary hearing and put his case before that hearing as recommended by the SIU in the report.
I see. Thank you so much for explaining that. That was Mvusiwekhaya Sicwetsha, spokesperson for the Eastern Cape Premier Oscar Mabuyane.